Thank you for joining us on the porch. I'm State Representative Jane Garibay, and I am here today with Representative Sean Scanlon, which is Branford and Guilford, right?
Yeah.
So we're so happy to have you today, and we welcome our viewers. So you are the son of a police officer and a small business owner. You learned the values of public service and hard work at a young age. After graduating from Guilford, you went to Boston College, and you worked as a victim advocate in the Manhattan District Attorney's Office before joining the staff of Chris Murphy. So that's pretty impressive. I've seen you've worked on tons of legislation that really helps people in, especially with insurance. And you helped people. Tell me a little, why don't you tell us, you can better say it, but I know you help people with pre-existing conditions.
Yeah. So when I was young, my parents got divorced when I was a kid, and my mom was a small business owner, as you just said. My mom never had health insurance, and I had insurance through my dad, who was a New York City police officer. So anytime I was sick, I would have to go to New York where his insurance worked. My mom never had insurance. And so I had no inclination that I ever was going to go into politics, Jane. But when I did decide to get more involved in politics, I really knew that I wanted to work on healthcare policy because I had seen up close and personal how not great our healthcare system was in America. And I wanted to get down to that. So when I got elected to the legislature in 2014, I asked to be put on the two healthcare committees in the legislature, which was insurance and public health. Right. And then sort of unexpectedly in 2017, I was asked to chair a committee in my second term, which almost never happens because I think the speaker had seen that I had a big passion for this. And I've tried to use the platform that I have as the chair of that committee to really fight for some stuff, like you said, pre-existing condition coverage, mental health parity, better and more affordable insurance coverage. These are all the kind of things that I'm excited to get up and go to work and work on every day.
And also opioids, right?
Yeah.
The opioid crisis. Last session, you were very passionate about that also. It does mean that when you feel it and you've lived it, just like people are out there, our constituents are living it, it's easier to go out and fight for them because you understand what they're going through.
Yeah, so I mean, people sometimes forget that all of us politicians are people too, right? And all of us bring lived experiences to the office that we hold. And I think we make better policy when we have those convictions and we have those experiences because we can really relate to the people that are going to be impacted the most by this. And I think that always puts us in a better lens, which is why it's so great that of the 187 of us in the legislature, there's so many different kinds of people and different kinds of experts on things. And that's why the beauty of what we do is we come together with those experts and they educate us and we educate them and we sort of just come out with the best product we can possibly come out with.
And we really represent the people.
Yeah.
Because you represent all walks of life.
For sure.
So very important in our special session that we just had were the bills on insulin. Can you talk a little bit about those?
Yeah, so I mean, I don't have to tell you this, Jane, you know it and your constituents know it. The price of insulin is just skyrocketing right now. It's tripled in the last 10 years alone. And I always tell people when they ask me why that is, I tell them a really quick story, which is that in 1923, the person who discovered insulin, Dr. Banting, he wanted to make sure that the drug was always going to be available and affordable to people. So he sold the patent for that drug for $1 100 years ago in 1923. It cost the three makers, there's three companies that make insulin right now, only one of them is based here in America. It cost each of them about $6 to make per vial of that. And Jane, would you know that they actually spend and they charge about $450 per vial of this drug? And that price, as I said, has tripled in the last 10 years. And so I started to notice more and more people coming to me and saying, hey, Sean, can you try to do something about this? I know that you work on healthcare. The price is getting out of control. And so this year, what we did was we put together a bill to try to make sure that we would make insulin affordable in Connecticut for people, regardless of who they were, regardless of where they were from in life, that nobody should have to be unaffordable insulin. Because literally, as you know, Jane, insulin is not a drug that you sort of take sometimes. And, you know, if you can afford it, you sort of cut a pill in half and like a lot of seniors have to do.
Yeah.
If you do not take the full dose of insulin, you literally go into shock and die within hours. And
Mhm.
so I just wanted to make sure that those voices were heard. We put together a bill in January, and then the coronavirus happened, as you very well know.
Right.
And that interrupted us, but I was really excited that we were able to get that bill on the agenda for the special session. And thanks to your support and the support of many others, we actually passed it.
Right. Yeah, it is so important. I come from a family with a long history of diabetes.
Yeah.
Um, I myself do not take insulin, but I've seen the effects of people and constituents that tell me they just can't afford it.
Yeah.
And having lived with people that have been on insulin, I know the importance that it has to be steady, it has to be
Yeah.
scheduled, and regular. But I grew up in the 70s, and I don't remember ever having to worry about health care.
Yeah.
Something switched midway, and everything, the greed when people are dying from it.
Yeah.
There was bipartisan support for the bill, wasn't there?
100% bipartisan support. We introduced it back in January at a press conference with Democrats and Republicans. And again, I always try to work across the aisle because
Right.
I think
I've
it's
seen you,
important.
so I know.
And sometimes we can't, right? But in
Mhm.
some cases like this, you have to put aside politics, Jane. And that's what you do all the time in the Capitol. I watch the way that you work. You don't care about who's a D or who's a R. You want to roll up your sleeves, you want to get to work, and you want to get the job done. And I'm proud of what that did. And if you'd like, I can sort of just go over what the top
Yes,
line of the bill is. So
absolutely.
the bill has three key components, right? The first one is to cap the cost of the copay that you pay for insulin at $25 a month. That's the lowest copay in the entire country. 7 other states have passed this, but we now have the lowest one in the country.
Okay.
The second thing that it does is that, as you know, having the drug itself is not the only thing you need if you're a type 1 diabetic. You need to buy the test strips, you need to buy the lancets, you need to buy the glucometers, you need to buy all this stuff. And we were hearing from people, I specifically remember there was a young man named Logan who was 13 years old. He testified that they spend $10,000 a year just on the supplies that this young boy needs to be able to take this drug. And so we are now the first state in the nation to cap the cost of the supplies at $100 a month. Only state in the country to do that. So that's the first section, is capping the cost for people that have insurance. So then the second thing we try to solve is what happens when there's an incident that occurs, when something goes wrong, whether it's your doctor's office is closed, it's a holiday weekend, you can't get a hold of anybody, and for some reason you go to CVS or Walgreens and boop, the pharmacist doesn't have a valid prescription for you. This tragically happened, Jane, to a young man named Kevin Howdy Shell in Ohio. And over it was the January holiday, January 1st, New Year's holiday, he went to his pharmacist that he went to every single month to pick up his prescription. The pharmacist said, "Hey, Kevin, I'm sorry. I know you. I give you this drug every month, but there's something went wrong." He couldn't get a hold of his doctor's office. His family found him dead in his apartment on Monday after this long weekend because he just simply couldn't afford it. So we passed what's known as Kevin's Law. It's passed in 20 states. And what it says is that you can walk into a pharmacy if you have less than a 7-day supply of insulin, and the pharmacist can make sure that you actually take the drug. They go through a couple steps with you. They try to call your doctor. They try to call the pharmacy that you usually go to. And if at the end of that process they can't get a hold of anybody, they will give you a 30-day supply of this drug so that you can figure out whatever it is that's going on and get that sorted out and then come back and get your normal prescription. So that's the second piece of
It
this.
makes so much sense. It's happened to me before with the med, and you're like, but I need to take it, and if you're a regular customer, and so that's great legislation.
And the pharmacist came to us and said, look, we love our customers. We want to help them, but our hands are legally tied. And this basically unties their hands and says that if in an emergency situation, they can write the prescription for that customer and give them that supply one time per year. So it can't be a recurring thing. It's only in the direst of emergencies that they can do this. And so the last part, Jane, is about the people we haven't talked about yet, right? So if we're covering the cost for people that have insurance and we're making sure that it's available for the people who have insurance, but there's a problem, we need to talk about the uninsured and the underinsured, which is the classic kind of people who we all talk to all the time, who for whatever reason, whether it's a lost job or they have a policy that just doesn't cover a lot, they have a high deductible, we want to make this drug affordable for those people. And so what we did was we passed the third piece of the law basically says that the DSS commissioner has to put together a working group to study the idea of expanding what's called the 340B pharmacy program to all people who are uninsured or underinsured. So what the heck is the 340B program? Well, the 340B program is a law passed by Congress in 1992. And what it did was it created this cheap drug program for people who get their health care either from a hospital or from a federally qualified health center. And for a lot of people in our society, that is the place that they go to get their health care. They don't have a primary care doctor. They don't have a normal doctor practice that maybe you and I go to. They go to these places for care, but they are sort of caught between being working poor and able to qualify for Medicaid, right? And so what we basically said to the commissioner was, you got to put this working group together and have them figure out how to implement this program for the normal people who we all hear the stories about all the time. They're working their butts off. They're working 2 or 3 jobs, but they just can't get by when it comes to healthcare. This program will help them do that. And by January 1st of 2022, she has got to implement that program so that the uninsured and the underinsured can find a place to finally get their affordable insulin.
Will that help the person, Sean, that is working a job, but they have a $5,000 deductible?
Yes.
They will
Absolutely
qualify.
Yeah, and that's unfortunately, you mentioned the trends that we're seeing in healthcare. World War II was really the first time that we start to see people getting their insurance through their employer. And that became the predominant way that most people have their insurance today. Mm-hmm. The problem is, and people listening to your show will know this, more and more employers can't afford the high cost of healthcare anymore. So they're switching their employees to these high deductible plans where they no longer have to pay the lion's share of it. And I don't begrudge the employers because it's getting more expensive for them too, right? At least they're still providing healthcare.
Right.
The problem is that they're now providing a healthcare that requires people like you and I to shell out a lot of money up front in order to even access that care. And so on another show, we'll talk about my ideas to solve that problem. But
absolutely.
that is a huge problem for insulin affordability because you're shelling out hundreds of dollars before you even meet that deductible. That's also, Jane, I would tell you, a really big problem for seniors on Medicare because of the donut hole. And so they are not able to access the drug in an affordable way because of the 4 stages of the Medicare donut hole. This would allow those people to do that. And that's why I think this is so, so important.
Right. Not to go off, but what are those 4 stages of the donut hole?
So it's a very, very wonky situation. Every January, Medicare comes out with what the different thresholds are, but the 4 stages are basically different kinds of coverage gaps that you have when you have Medicare. So the first one, you have to spend a couple $100. The next one, you have to spend a couple $1,000. Then you're in the donut hole. And then after that, you're out of the donut hole, but you're back to spending more money. It's a very convoluted process that I wish the Congress would really fix, because the donut hole is something I hear a lot about from seniors in my district. I'm sure you do up in Windsor and Windsor Locks too. But we want to make sure that if you're trapped in that donut hole and you have thousands of dollars to go until you get out of it, that you can at least access that affordable insulin. And when I say affordable, Jane, I'm talking about really affordable. We had a woman testify who runs the Fairhaven Community Health Center here in New Haven down by me. The cost of the most common insulins that she is prescribing at that center are literally less than $1 in some cases. Wow. Now go back and remember when I said $450. These people get it for a couple of dollars. This is a home run. It's something that should be open to everybody. And ironically, the weirdest part about all this, Jane, is that we passed our bill, as you know, on Thursday afternoon. On Friday, I turned on the news and I watched President Trump doing a press conference in which he announces that he was doing an executive order creating the exact same thing that our bill did. So it just goes to show you that this is a very bipartisan thing. This is not political at all. These are solutions that we all see as common sense, and I'm glad that we're getting them done.
I am too. My mother passed away about 11 years ago. And again, she was on insulin, but even back then with her Medicare, Social Security, she could afford her insulin. It's like in the past 10 years, it's just gone out of control. So I want to thank you for leading us all on this legislation.
Very welcome.
And so happy for our constituents in Connecticut that they'll be able to afford and stay healthy. Do you remember what the percentage is of people that are diabetic?
So there's about 250,000 people in Connecticut who are diabetic, and about 30% of those are type 1 diabetic, meaning that they have to inject themselves every day, to stay alive with insulin. So we're talking about tens of thousands of people here whose lives, I think, really are going to change for the better over this. And I keep thinking about the stories that we heard, Jane. You sit in these public hearings and you hear the real life stories, right? I'll just give you a few because
Yes,
they're stuck with me,
absolutely.
right? I mean, you had Logan, who I talked about earlier, who's the kid who spent $10,000 a year on supplies. You had another kid named Campbell, who was from Richfield, who testified and said he spends more on insulin every year than it does for him to pay his tuition to go to Western Connecticut State University.
Wow.
We had another woman, Bunny, who was a grandmother from Hamden. She said she started taking the same drug, the same insulin in 1995, cost her $25. Today, she spends $550. I mean, these are just people who need a break. I mean, it just should never cost more to take a drug that, again, was sold for $1 in 1923 than it costs for you to go to college education at a state university in Connecticut. That's just wrong. And I'm glad that you and I and our colleagues decided to fix this year.
Yeah. And the inventor, he only charged $1 because he wanted it to be accessible to all people. That was his intention, correct?
That's the intention. I mean, we talk a lot about vaccines, and we're obviously spending a lot of time thinking about that. The people who invent these things are doing it because in a lot of cases they have a personal connection to it, whether it's a son or a daughter, and they want to solve these problems. But the pharmaceutical companies come in and distort that so much. And that is exactly what happened here, where, again, you have 3 makers of this drug. The drug has really not changed a lot, except for a couple of tweaks that they make to protect their patents since this person founded it. And I just think it's absolutely unconscionable that we don't allow people who literally need this to survive to access it affordably if nothing has changed. Right. If you come up with a miracle drug to solve cancer, I understand that drug is going to cost some money because you got to catch up to the R&D costs and the marketing, all this stuff. But when you bought a drug for $1, there's no justification for it.
Right. I totally agree. Well, I want to thank you so much for coming on to the show, Sean, and sharing that so that people understand. And I even learned a little bit more, so that's good too.
Yeah.
It was really nice having you. So I want to thank Win TV and Jamel, who's helping us today. And I want to thank everyone for tuning in to On the Porch. And we hope to see you next week with another informative and exciting On the Porch. Thank you, Sean.
Thank you, Jane. Good to be with you.